You've probably heard the phrase, "It's not the fall that gets you, it's the landing." But after the age of 70, it's not just about how you fall. It's what happens afterward that really counts. A fall might seem harmless at first. Maybe it's just a trip. Maybe you hit the floor a little harder than you intended. But you get up, dust yourself off, and go about your day. Right? Wrong. For seniors, especially those over 70, the worst thing you can do after a fall is exactly what most people do. Nothing. That's the one mistake that puts you at an even greater risk for severe injuries, long recovery times, and long-term complications. After a fall, it's tempting to shake it off. You might feel embarrassed. You might think it was just a little trip. Maybe you've fallen before and bounced back quickly. Or perhaps you don't want to cause a scene. But here's the harsh truth. Ignoring what happened could be the difference between a quick recovery and a long-term struggle. In fact, studies show that 95% of seniors make this mistake. And it's one of the biggest contributors to why falls are so dangerous as we get older. So what should you do? The first step is don't just get up and keep going. Your body changes over time, your bones, your muscles, and especially your balance. A fall might be a warning sign, not just a clumsy moment. But so many seniors make the mistake of thinking everything is fine because they don't feel immediate pain. They get up, walk it off, and go back to their routine, only to find out days or even weeks later that they've seriously injured themselves. That moment of ignoring the signs can lead to fractures, sprains, or worse, bruising and internal damage that doesn't show up right away. And it's not just about breaking bones. A fall can also damage your confidence. The psychological effects of falling are real. Many seniors report being afraid to walk after they've taken a tumble. Fear of falling again can limit mobility, which only makes things worse. The less you move, the weaker your muscles become, and the more prone you are to another fall. It's a vicious cycle, and it all starts with one decision: whether or not you acknowledge the fall and take the right steps to recover. So, what should you do after a fall? First, stay down. Take a moment to assess your body. Don't rush to get up. If you're able to, try to move your fingers and toes, wiggle your feet. Assess if anything feels wrong. Sharp pain, weakness, or inability to move. Don't assume everything is fine just because you can get up. Sometimes it's a delayed injury. Sometimes you might feel fine, but there's internal damage that doesn't become noticeable right away. The worst thing you can do is get up too quickly and continue with your day as if nothing happened. Once you're on the ground, if you're feeling okay, try to get up safely. Roll onto your side, bend your knees, and push yourself up slowly from the ground. Avoid twisting or jerking movements. Use a sturdy piece of furniture, a chair, or a countertop to help you rise. If you can't get up on your own, don't panic. Stay where you are, keep calm, and call for help. It's better to ask for assistance than risk further injury by attempting to stand up too fast. Here's where things get tricky. After you've fallen, you may feel fine for a few hours. You might think, "I'm good. It wasn't that bad," but that's where a lot of people go wrong. It's essential to seek medical attention after a fall, even if you don't feel immediate pain. A quick trip to the doctor or urgent care can save you from unknowingly making an injury worse. Your doctor will likely check for fractures, joint damage, or hidden issues that might not be obvious but can impact your mobility down the road. One of the most common injuries seniors face after a fall that they often don't notice right away is hip fractures. According to experts, nearly 300,000 older adults suffer from hip fractures every year. The problem is, Many people don't realize they've fractured their hip right after a fall. It might just feel like a bruise or a small ache, but the fracture can lead to complications like blood clots, mobility issues, and chronic pain. If you're feeling even the slightest bit of pain in your hip, leg, or lower back, it's worth getting checked out. Don't wait for the pain to intensify or worsen over time. Early treatment is key. Another major issue that arises from falls is head injuries. Concussions can happen even if you don't hit your head directly. If you fall backward or to the side, your head might jolt or hit the floor in an awkward way. Even a mild concussion can cause long-term symptoms such as dizziness, headaches, confusion, and difficulty concentrating. After a fall, it's important to look for any changes in your cognitive function. If you start feeling unusually tired, confused, or dizzy, it could be a sign of a head injury. Don't let this slide. Now let's talk about something equally important: prevention. It's easy to think that falls happen randomly, and sometimes they do. But the reality is, most falls are preventable. If you're over 70, it's essential to think about fall-proofing your home. Remove rugs that could slip, ensure that your hallways are well lit, and install grab bars in the bathroom. Consider wearing shoes with non-slip soles. The more prepared you are to prevent a fall, the less likely it is that you'll end up in the emergency room. If any of this resonates with you, and you're realizing that it's time to start thinking differently about how you recover after a fall, comment one below. Your health and well-being depend on being proactive, not reactive. Taking care of your body after a fall can make all the difference in how quickly you recover and how long you maintain your independence. So don't wait until it's too late. Start making safer choices now. The critical thing to remember after a fall is that delaying medical attention is one of the worst things you can do. A significant portion of older adults fail to seek professional care right away, assuming they can recover on their own. Even if you feel okay in the moment, you might not feel the impact until later on. This could be because your body is in a state of shock or the injury hasn't fully manifested. You might be tempted to say, "It's just a bruise. I'll be fine," but when it comes to falls after the age of 70, this approach can lead to complications that affect your long-term health. That small moment of dismissing the injury could result in longer recovery times, pain, and even disability that you might have avoided with early intervention. One of the most common injuries from falls, and one that is often overlooked, is spinal injury. Seniors are particularly vulnerable to spinal fractures or misalignments, which can be difficult to detect immediately after a fall. The shock from a fall may mask pain until your body starts to settle and the inflammation builds. Even a slight misalignment in the spine can cause long-term nerve pain, and if the fracture involves the vertebrae, it can impact your ability to move freely. It's important to get your spine checked by a medical professional after a fall, especially if you experience tingling, numbness, or a feeling of weakness in your arms or legs. These signs could be a red flag for nerve damage that may not be immediately obvious. The next big mistake people make after a fall is neglecting to rest. Yes, it's incredibly tempting to try to push through a fall, get back on your feet, and continue with your day-to-day activities as if nothing happened. But that kind of thinking often worsens the injury. Your body needs time to heal. When you don't allow enough time for your muscles, ligaments, and bones to repair, you can create lasting damage. If you've fallen and are dealing with bruises, sprains, or even just soreness, the best thing you can do is give your body a break. Apply ice or a cold compress. Elevate the affected area to reduce swelling and take it easy. A few days of rest could prevent months of chronic pain or disability. Your body's natural healing process is highly effective, but only if you allow it the time and support it needs. Similarly, overexerting yourself after a fall can lead to something called compensatory strain. This happens when, after experiencing pain or injury in one part of the body, you try to use other muscles to make up for the weakness. For example, if you twist your ankle during a fall, you might subconsciously start favoring your other leg more, which can cause strain in that leg, your back, or your hip. Over time, this compensatory strain can lead to further injuries, creating a cascade of problems that could have been avoided. That's why it's so important to be mindful of your movements and take care of your body in the days and weeks following a fall. Giving your muscles time to relax and return to their natural balance will help prevent unnecessary strain on the rest of your body. Another mistake many people make is ignoring pain after a fall. It's easy to tell yourself, "It's just a little ache. I don't need to see a doctor." But what seems like minor pain could be a sign of something much worse. For instance, a sore ankle may just seem like a bruise, but it could be masking a fracture or ligament damage that will get worse if left untreated. If you notice that pain increases when you move, or you have trouble doing simple tasks like walking, bending over, or standing up, don't hesitate to get it checked out. Catching and treating injuries early makes a world of difference in how fast and effectively you recover. Let's talk about the mental impact of a fall. The fear of falling again can be just as debilitating as the fall itself. After experiencing a fall, many older adults develop a fear of moving around too much. They become cautious, hesitant, and start limiting their activity. This fear can worsen your mobility and make you feel more dependent on others. In fact, studies have shown that people who are afraid of falling are more likely to experience another fall. It becomes a self-fulfilling prophecy. This is why it's so crucial to address the mental aspect of recovery too. If you're feeling anxious or scared about moving around after a fall, talk to your doctor. They may recommend physical therapy or offer strategies to rebuild your confidence and strength. Physical therapy isn't just for big accidents. It's a crucial part of recovery after any fall. If you don't have significant injuries but still experience pain or discomfort, physical therapy can help restore function, improve balance, and prevent future falls. A trained therapist can guide you through exercises that strengthen your muscles, improve your posture, and restore your range of motion. These small changes can make a huge difference in reducing the likelihood of falls in the future and help you feel more confident in your mobility. Medication is another factor to consider after a fall. Many older adults are on medications that affect their balance or strength. Medications like sedatives, antihypertensives, or painkillers can cause dizziness, weakness, or a delayed reaction time. If you've fallen and you're on medications that might contribute to these risks, it's important to talk to your healthcare provider. They may recommend adjusting your medications or switching to alternatives that are less likely to cause dizziness or loss of coordination. It's better to be proactive about your medication than to let it silently contribute to the likelihood of future falls. And of course, fall prevention is the final step in keeping yourself safe. After you've healed from a fall, you'll need to take steps to prevent it from happening again. Most falls can be avoided with simple adjustments around the house. Install grab bars in the bathroom, use non-slip mats in the shower, make sure your home is well lit, and remove clutter or anything you could trip over. Wear proper shoes with non-slip soles, stay active. Regular exercise helps improve strength, flexibility, and balance, all of which are key to reducing your risk of falling. Prevention isn't just a matter of being cautious. It's about making your environment safe and strengthening your body to handle the demands of daily life without unnecessary risk. If you're reading this and thinking about the falls that might be coming in your life, or remembering one that already happened, comment one below. It's a reminder that your body is telling you something. A fall isn't just an accident, it's a wake-up call. And if you take the right steps now, you can recover faster, prevent future falls, and keep living the life you want. And if you haven't already, subscribe and hit the bell for more content like this. We talk about how to make aging safer, smarter, and more sustainable. It's never too late to take control of your health. And this community is here to guide you. Let's stay connected, stay informed, and keep learning from each other. See you in the next one.